remedy from Phatak Materia Medica. It is the 24th episodes of Phatak Materia Medica live series. So let us start with the new remedy, a big remedy, polycrest remedy of the our Materia Medica, a very important remedy in day-to-day practice. This is a remedy is AMBRA GRISEA. So Dr. Phatak describe AMBRA GRISEA, its action on the deep action on the nerves. So nervous remedy, action on the nerves is nervousness, twitching, jerks, trembling, oversensitivity. So this is a remedy of exhausted nervous system. These patients are worn out, mentally sensitive, physically weak, emotionally fragile. Yet every small stimulus affects them deeply. So Dr. Phatak said patients are worn out yet over impressible. That's the single line. This is the soul of AMBRA GRISEA. Patients are worn out yet over impressible. So let us understand the which kind of patients did AMBRA GRISEA we commonly found. This is thin, scrawny, weak, aged, prematurely aged, or young modern society girl with fragile nerves. Very important is not weakness alone, it is a weakness plus hypersensitivity. So patient may say that doctor, I am too weak to force the stimulation. That is noise, music, people, embarrassment, emotion, everything overloads the system. So AMBRA patient doesn't lack strength, they lack the tolerance. So the classical AMBRA patients are elderly with declining functions, patients weakened by overwork, patient exhausted by mental strain, woman with nervous disorder, young society model girl with fragile nerves. Emotional background is domestic shock. So causative or elements from is domestic shock, business failure, repeated deaths in the family, loss of near relatives. So these elements from is very important. That is domestic shock, business failure, repeated deaths in the family, loss of near relatives. These shock doesn't create a violence. These shocks create a collapse inwards. So the mental picture of the AMBRA GRISEA is memory and thinking, memory impaired, slow comprehension, cannot understand what they read, time passes too slowly. Dreamy, ideas keep changing, jumping from one subject to another, never wants to one question to be answered. Emotional state, melancholy, sits for the days with weeping, sad without clear reasons, but not a dramatic crying like Ignatia. This is a quite continuous sorrow. Fear and imaginations imagines diabolic faces, strange sights, fixed disagreeable fancies. These are the nervous hallucinations, not a psychosis. In social content, dread of people, desire to be alone, presence of other aggravates. So the key word of AMBRA GRISEA is cannot pass urine or stool in presence of other. This is a classic, as we learn from our college, cannot pass urine or stool in presence of other. So this shows that embarrassment and bashfulness, blushes easily, awkward, hearing other talks affect her, even talking herself aggravates. So doctor, when someone is watching me, I feels worse. This is a classic verse of AMBRA GRISEA. Music causes music is another factor that affects the AMBRA GRISEA much more. Music causes weeping, trembling, emotional breakdown. So music aggravates mind, heart and respiratory symptoms. Music makes the patient worse, not better. So when the music makes worse, we must think of AMBRA GRISEA. General sensitivity, AMBRA reacts slightest thing, unusual thing, emotional stimuli, social pressure, so small stimulus lead to big reaction. One-sided and changeability, one-sided complaint, symptoms change one place to another as pulsatilla. This reflects unstable nervous control. In physical general, AMBRA is not diagnosed by pathology first, it is diagnosed by physical generals and modalities. So, thermal and sensation, coldness is the strong key. AMBRA feels coldness all over the body, coldness in the spot, coldness in the fingers, coldness in the abdomen, cold in the arms. So, another this often coldness associated with twitching, trembling and numbness. So, patient may say that doctor, my hand feel colds, and then they start twitching or they start numbness. This combination is characteristic of AMBRA GRISEA. Numbness and terror. So, numbness of whole body, torpor, especially in the morning, limbs go to the sleep easily. So, AMBRA wakes up tired and as if nerves were never slept. Weakness pattern is very important in the AMBRA GRISEA. Weakness of upper body, trembling of lower part, control of the nerves, control from the nervous system is failing. Control from the nervous system is failing. So, patient may say that my legs tremble when I stand but my chest feel weak. So, this is the keynote. Sensitivity to the slight. So, slight or unusual things aggravates the AMBRA symptom such as breathing, heart, muscle and nervous system. Slight exertion, slight emotional stress, presence of other people, embarrassment causes aggravation. So, AMBRA as the cause is small and collapse is big. So, modalities aggravating factor to the AMBRA is first is music, must be remember, presence of other, embarrassment, agitation, worry, thinking of complaints, overlifting, any unusual thing, morning, warmth, warm milk. So, and ameliorating factor is slow motion, open air, lying on the painful part and cold drinks. So, AMBRA improves with cold, not with warm. This is differentiating point. Appetite, thirstlessness is important as seen in the pulsatilla, sour taste in the mouth, soreness of the milk, heartburn from the milk. Milk is a strong aggravating factor of the AMBRA. Mental and gastric sensitivity to go together. Sleep, cannot sleep from worry. Music gets up from the bed, must get up from the bed. Retires tired as soon as his head touches pillow, awakes. So, this is classic of AMBRA. AMBRA patient may say that I am tired the whole day but night sleep doesn't come. In general nervous system, twitching of muscle, jerking during sleep, trembling, general pulsation, skin and sweat, itching all over the body, soreness, sweat on abdomen, thigh, sweat from the slightest exertion. So, AMBRA is some characteristic as seen above: coldness with twitching, morning numbness, trembling from weakness, oversensitivity to the small causes, aggravation from warm milk and people, better in open air and cold drink. So, particular symptoms, head symptoms, senile vertigo, a good remedy, vertigo with weakness in the head and stomach, headache, tearing pain in the upper part of the brain, headache aggravated by blowing the nose upwards, confusion in the occiput, sprain feeling in the occiput. Sensation in the brain feels loose as if it would fall to the side when lying. Hair falls out, especially weak nervous patients. Eye symptoms with nervous fatigue, stitching in the eyes as if style is forming, stitching in the eyelids as if style is forming, eyelids feels heavy, cannot open through awake. In ear symptom, hardness of hearing, one-sided, cold sensation in the abdomen, deaf in the one ear, roaring and whistling in the another, one-sided with changeability with nervous origin. Nose and bleeding, nosebleed while washing the face, morning and epistaxis during menses. Nosebleed with weak nervous woman, think of AMBRA GRISEA. Face symptoms, twitching of facial muscles, cramps in the lips feel hot, left cheek red, flushes of the face. Embarrassed look is very important. Locked jaw in the newborn. Mouth symptom, profuse bleeding from the gums, offensive breath, ranula, sore mouth, aggravation from milk, sensation of throat, sensation of as if stuck in the throat, difficulty in swallowing, raw, sore feeling, aggravation from exposure to air, aggravation from moving the tongue. Stomach symptoms, AMBRA has peculiar post-eating symptom. After eating, cough, gripping, feeling of food did not go down. Eructation with violent convulsive cough, heartburn from drinking milk, distension of stomach after midnight, thirstlessness. In abdomen, flatulence, very flatulent remedy, cannot pass stool or urine in front of other. Aggravation during pregnancy, sensation of coldness in the abdomen, constipation during pregnancy, after delivery, aching in the small spot of the liver, better from pressure, large flow of blood with stool, sweat on the abdomen and thigh, frequent ineffectual urging to stool. In urinary system, Dr. Phatak says that pain in the bladder and rectum at the same time, cannot pass as urine in front of others. So, doctor, if someone is nearby, I can't pass the urine. Feeling as if few drops pass out, urine is turbid during emission, brown segment, urinates more than drinks, urine sore during whooping cough, burning, smarting and itching in the vulva during urination. Sexual organ smells, vulpurous excitement, itching of the genital, external numbness, internal burning, erection without desire, impotence. In female, itching of pedundium, soreness, swelling, itching of labia, bleeding in between the periods from slightest exertion, walking a little longer, hard stool. Leukorrhea, bluish mucus, profuse watery aggravation at night, sexual desire increased, lying down aggravates uterine complaint, menses too early to profuse. So, in respiratory complaint, asthmatic breathing in old people, aggravation from caution. Cough, hollow, spasmodic, barking comes from the deep chest. Then erection follows. Expectoration, bluish white, cough, aggravation, music, presence of other people, talking, reading aloud, lifting a weight. Loss of breath from cough, cough with expectoration. Heart symptoms, palpitation with pressure, as if a lump lodged in the chest, as if chest is obstructed, palpitation with pale face, anxiety in the heart. Extremity, cramps in the hands and fingers, aggravation from grasping, twitching of the limbs during sleep, coldness of the body, cramps of the legs and calves, limbs go to sleep easily, fingers nail brittle, drops thing from hand, coldness of the left hand with headache, rawness in between the thighs. Cannot sleep from worry, must get up, awake as soon as head touches the pillow. So, in day-to-day practice, The nervous cough aggravates by music, cannot urinate in presence of other or stool, twitching and jerking in the cramps, bleeding from the slightest causes, coldness, weakness and embarrassment. So, in day-to-day modern practice, which type of diagnostic condition we may see in the AMBRA GRISEA is neuropsychosomatic conditions. AMBRA patient often comes with in clinic anxiety disorder, social anxiety, performance anxiety, psychosomatic complaints, that especially when symptoms aggravate in presence of other and embarrassment is dominant. In cardiorespiratory symptom, palpitation with anxiety, breathlessness without structural heart disease, nervous asthma in the elderly. In chronic cough of teachers, speakers and elderly patients cough and vocal cord strain. So, we have to differentiate many more remedies with the AMBRA GRISEA. So, first and foremost remedy which is the we must differentiate with the AMBRA GRISEA is ignatia. So, in mind symptoms, AMBRA is quite embarrassed, inward and shy, while ignatia is emotional, dramatic and contradictory. In physical complaints, AMBRA has cough aggravation from music and people, ignatia cough better by deep breathing. So, ignatia react emotionally, AMBRA collapse nervously. Another remedy we must differentiate is argentum nitricum. In mind symptom, AMBRA is timid, bashful, embarrassed. Argentum nitricum is impulsive, anticipatory anxiety and hurried. Urine symptom, AMBRA cannot urinate in presence of other while argentum nitricum urinates frequently from anxiety. So, argentum nitricum runs ahead, AMBRA freezes. Another remedy is gelsemium. So, in mind symptom, AMBRA is sensitive to people and embarrassment. Gelsemium has fear of anticipation, dull, examination of dull, dizzy, drowsy, examination fear. In physical symptoms, AMBRA twitching and coldness, gelsemium has heaviness and paralytic like weakness. So, gelsemium drops, AMBRA trembles. Another remedy which is close as we discussed early in the particular symptom is the pulsatilla. AMBRA wants to be alone, pulsatilla wants to be company, pulsatilla wants consolation. In thermal, AMBRA is cold, better by colding. Pulsatilla is warm blooded, better in open air, dislikes the cold drink. So, pulsatilla seeks comfort, AMBRA avoids exposure. Another remedy which is very nearer to the AMBRA GRISEA is the cilicia. AMBRA is embarrassed easily, shy, nervous, presence of other causes nervousness. In cilicia, cilicia is timid but obstinate, lack of confidence, stage of pride. In physical symptoms, AMBRA cannot pass urine and stool in presence of other, while cilicia has profuse sweat on the head, chilly, slow recovery. So, cilicia lacks confidence, AMBRA freezes from embarrassment. Another remedy is Califos. A very nearer analog of the AMBRA GRISEA is Califos. AMBRA GRISEA is hypersensitiveness, over impressionable, while Califos is mental exhaustion, burnout, depression. AMBRA has twitching, coldness and nervous irritation. Califos has prostration, weakness without twitching. So, Califos is empty, AMBRA is overstimulated. Another remedy, female remedy which is very nearer to the AMBRA GRISEA is sepia. AMBRA wants to be alone due to the embarrassment, sepia wants to be alone due to the indifference. Physical symptoms, AMBRA has cold, nervous, trembling, sepia is bearing down symptoms and battled by exercise or dancing. So, sepia is detached, AMBRA is delicate. Another remedy which is very close to the AMBRA GRISEA is lycopodium. So, AMBRA is shy, bashful, avoids the people. Lycopodium has fear of dominating, wants control and AMBRA has cold, weak nervous system. Lycopodium has digestive issue, bloating, 4 to 8 pm aggravation, sweet desire. Lycopodium compensate, AMBRA withdraws. Another remedy that is nearer to the AMBRA GRISEA is natrum mur. So, natrum mur is reserved closed grief bearing. AMBRA is embraced socially inhibited. In physical, natrum mur has headache, dryness, morning aggravation, craving for the salt. AMBRA has twitching and nervous cough. So, natrum mur holds emotion, AMBRA overwhelmed by them. Another remedy is phosphorus. Phosphorus has loves company, fear of being alone. AMBRA has dread of people and bashful. In physical, generals, phosphorus is hot, thirsty, bleeding tendency, desire for cold drinks. AMBRA also has desire for cold drinks and cold and better by cold drinks. So, phosphorus seeks people, AMBRA avoids them. Another remedy is calcarea carb. Calcarea carb is fat, flabby, anxious, slow, security seeking, while AMBRA is nervous and embarrassed and sensitive. In physical level, AMBRA is thin, scrawny and trembling. Calcarea is fat, flabby, sweaty and desire for the eggs. Calcarea is heavy and slow, while AMBRA is light and shaky. Another remedy is aurum metallicum. Aurum has deep despair, depression, self-condemnation, while AMBRA is quiet sadness and inward collapse. AMBRA has structural pathology, aurum has structural pathology, heart and bones, while AMBRA has functional nervous complaints. So, aurum breaks from the guilt, AMBRA breaks from the sensitivity. So, in remedy relationship, the Dr. Phatak mentions that the complementary and related remedies of the AMBRA GRISEA is Ignatia, having grip background, Baryta carb, having aged and weak and childish look, Gelsemium having nervous weakness, so often confused with Argentum nitricum and Pulsatilla. So, AMBRA has embarrassment and nervous inhibition. So, common prescribing mistakes while prescribing the AMBRA is only for anxiety, weakness and oldness, but AMBRA must have embarrassment, social aggravation and overreaction. So, confusion with Ignatia in grip cases, if patient is expressive, think of Ignatia, if patient is withdrawn, think of AMBRA. So, golden points of the AMBRA GRISEA: cannot pass stool and urine in presence of other, music aggravation, and AMBRA more about inhibition, not about expression. So, nervous weakness, hypersensitivity, embarrassment, presence of other, aggravation, cannot urinate in presence of other, aggravation from music, coldness, twitching and trembling, aggravation from warm milk and warmth, better from open air and cold drink, quiet, sadness, bashful and desire to be alone. So, AMBRA must be prescribed by behavior, not by diagnosis. In OPD, look of the patient in the AMBRA is very important. AMBRA speaks softly, avoids eye to eye contact, appears embarrassed, gives symptoms hesitantly, says that I feel awkward explaining these symptoms. Patient is not sick loudly, he sick is quietly. In potency selection, 30 to 100 and 1 m is the choice of potency, depends upon the sensitivity and susceptibility and pathology of the patient. Mainly 200 potency commonly I prescribe. So, this is all about AMBRA GRISEA, a very big remedy. Thanks for patience listening. We will see in the next episode. Thank you very much.